Most of the serious injuries that we're seeing in the emergency department are very preventable, and a few simple steps will make a big difference. You have to keep in mind that a firework is a mini explosive. It's a miniature form of dynamite or TNT, and so it's not a toy. One of the key factors that I like to bring out is that it's probably a good idea to leave it to the pros when you can. Public shows are far safer than backyard fireworks. I've been an example of that in my own backyard, as well as seeing it happen to others as well. But if you do use fireworks, a couple of key points that I like to make. Um, Light them when you're sober, light them outdoors, light them on flat ground, away from homes, trees, and dry grass. And on that point, it's always good to have a bailout sort of idea in mind. So I like to have a pail of water, running hose nearby. I think if you plan for the worst possible outcome, it won't happen as often. But if you don't plan, it seems to always find its way in there. So the other thing too is keep children back because it's not a toy. Even the sparklers. So a lot of people are very mindful of little children when it comes to black cat fireworks or M80s, but they'll give them a sparkler and tell them to run around with that. Sparklers can burn at up to 2,000 degrees Fahrenheit. So that's 10 times hotter than 200 degrees Fahrenheit. Really, really hot. And I've seen burns on children's hands, arms, face. The other thing is those little sparks that come off the sparklers, if they get on the cornea of the eye, they can cause something called punctate keratitis. So they can cause damage to the cornea. And usually that'll go away on its own, but it's painful for up to 3 days afterwards. And sometimes it causes an infection to occur there, and that's a bigger problem.
Okay. Wow. And so I think in your experience during New Year's, I mean, do you guys usually see a good amount of patients come in because of firework danger or firework incidents and accidents?
Yeah, at New Year's, I've seen somebody holding a high level M80 in their hand and actually amputate their hand from holding a firework that he thought the fuse had gone out on. And so that's dangerous. And so duds can be a dangerous situation with fireworks. I've seen the eye injuries. I've seen burns to the hands, burns to the face, burns to the chest. Yeah, that brings up another key point, if I can talk about that, Naomi, in terms of duds. When it comes to fireworks that don't go off, duds stay duds. You never try to relight them. In fact, a good thing to do is pour water over them, soak them in water. That goes to my idea of having a bucket of water nearby and a running hose nearby too. And
Um,
the other
I go ahead. Sorry, go ahead. You can
Oh no,
finish.
not at all. The other thing is
Oh,
talking about those eye injuries. Well, a great way to prevent those eye injuries that I have seen in the emergency department at Prisma Richland is to wear eye protection. You wouldn't go out in the yard and chop up a bunch of bushes and get knee deep in the weeds and thorns without having eye protection on. If you're using fireworks or sparklers, it's a good idea to have eye protection on too. If you wear glasses, that's probably good enough. But if you don't, just a pair of really cheap, thin safety glasses is a good idea to throw on before you go and light off fireworks or deal with sparklers.
Mhm. And now, can I ask this for parents out there that are planning on doing a little, let's say, backyard light show or neighbors or anything like that? I guess when's the right time? When's the best time to go visit the ER? Like, when can you, as a parent, decide, okay, you know what, my kid was probably severely burned? Besides the obvious, like you mentioned, somebody who's maybe, their arm is like dangling or you're having to be amputated. But if my kid gets like a little burn on their arm, like is it something that is, we need to go to the ER right now? Kind of where's the telltale line to kind of decide, okay, this is a serious injury versus this is just a little burn that will probably go away in a couple of days.
Yeah, that's an excellent question. So you basically, if it looks like a sunburn, then you don't need to go to the emergency department. But if it's blistering upward, or if it's white, gray, or charred looking, that needs to come to the emergency department and get checked out because they can get infected. And so it's good to have us take a look at it on the front end rather than at the back end once it's gotten red and draining and infected. Um, any burns of any nature on the hands or the feet or the genitals or on the face ought to come in and have us check them out. If nothing else, we'll get you on the right program of what to put on that to get it to heal correctly for you at home. and expeditiously at home.
Okay. So kind of summary here for us, if you don't mind. Kind of give me the lay of the facts again, like you mentioned. If you are going to go, like it just kind of repeat kind of what you said earlier. If you are planning on going out, keep the three things I think you mentioned in mind. If you don't mind, kind of just give me that background.
Yeah, absolutely, Naomi. In summary, eye injury. Wear some protective goggles on your eyes or glasses on your eyes so that you don't get eye injuries. But if you do, don't rub it, rinse it right away. Tap water is okay. Don't apply pressure to it. In fact, the best thing to do if you have an eye injury is to take a foam cup or a Dixie cup, put it around the eye, and tape it on either side so that it's covered, but there's no pressure on the eyeball itself. Because you don't want to put pressure on the eyeball in case there's a break in the eyeball, a poke in it, a hole in it that could cause more and more damage if you put pressure on it. Burns, if you've got burns, cool, clean water, not ice, because ice can cause frostbite and actually worsen the injury. So cool, clean water, and then cover it with a clean cloth, and come into the emergency department if it's on the hands, feet, genitals, face, or if it's blistering or gray or white and charred looking. Basically, anything more than just a deep sunburn, you ought to come in for. And then lastly, 911 for any large burns or anything that explodes near the face, the chest, the hands. If the person is having any trouble breathing or feels lightheaded or like they may pass out afterwards, come on in. We're ready for you at the trauma center at Prisma Richland, and we'll take care of you.
I love that. And then just lastly for you, I had one more and now it's just completely escaping my mind. That's right. Your advice, leave it to the professionals. In the case of backyard fireworks versus professional fireworks, it's probably best knowing what you've seen and what you've kind of just described now. Do you think people maybe have that conception that like, oh, fireworks can be safe and I'm just gonna go and do it and I mean, I was in with my friends the other, I think a couple of years ago, and one of the little sparklers literally was supposed to go up and it went sideways and it hit somebody in the leg. And,
Yeah.
you know, granted, it was thankfully it wasn't anything too severe. It was very minor. It looked like a sunburn. But, you know, do you think people have this kind of like stereotype, like I can just kind of do it. It's going to be fun, no problem. You think that's an issue that people kind of face during this time of year and for 4th of July?
Yeah, I think so. Absolutely. I think 4th of July and New Year's definitely bring out the, hey, watch this sort of thing that my friends and I have been guilty of in the past. Um, and yeah, and I've also had one of those mortars put out in the middle of a golf course. So I thought it was away from everything, fall over on its side and start shooting sideways over the heads of the people that were watching. And that day ended with hit the deck, everybody, and hoping that we weren't going to set anybody's house on fire. But yeah, and we were trying to be really safe. We had water handy. We thought it was on flat ground. Yeah, leaving it to the professionals is a good way to go. You'll have a lot more fun with it. In your neighborhood, you have to be careful also that you're not lighting off fireworks near pets who have very sensitive hearing, or maybe older people that are wearing hearing aids that it'll really, really augment that sound. Veterans may have trouble hearing the sound of what sounds like gunfire to them. So it's probably not a bad idea to go to Fort Jackson or down to the ballpark and see a professional fireworks show. That way you can just sit back and enjoy it. You don't have to be involved with the show or, God forbid, part of the show.
Right. Well,
Dr.
thank you so
Dr.
much,
Ford, can
Doctor.
you, I was gonna say that
Yeah.
same thing, Norma. Dr. Ford, can you just summarize, something like we actually, encourage people just to see the professionals, that kind of thing, just in a
Yeah,
one time.
absolutely. Yeah, Naomi, I think that the best way to deal with New Year's Eve and with the 4th of July is go to a professional fireworks show. It's safer. You'll have more fun. You don't have to do anything. You can just sit back and enjoy. And their show is a whole lot better than any show that I could put on.
Yeah, or very many other people out there, let's be really honest. Well, thank you so much, Dr. Ford. I really appreciate you taking the time, especially today. I know it's been really hectic with the holidays, so we really appreciate it. Thank you.